right. Hi, my name's Kate. I'm an intern with Leadership Initiatives, and I am going to be helping diagnose this patient today. So would you mind just telling me the patient's name, please? And if it's all right, I'd love to ask a few questions about her.
Okay, it's nice having you around, Kate. Patient's name is Khairi, a 20-year-old housewife who is 7 months amenorrheic and presented with a history of 2 days fever, headache, dizziness, and blurry vision.
Okay. Yes, I got that. Thank you. And has the patient been experiencing any abdominal pain or constipation or vomiting at all?
There's no abdominal pain. There's no constipation. Had one episode of vomiting. And no
okay, no vomiting. All right. And have they experienced at all any full body aches or any loss of appetite?
She has loss of appetite with joint ache. No body swelling.
Okay. And has the patient felt like her eyes have been discolored at all? She feels
no
pain.
Discoloration.
Okay.
No discoloration. No surface.
And does the patient have a cough at all, or a runny nose, or nasal congestion?
There's no cough. Nasal congestion.
Okay. So based on the patient, I suspect that patient may be suffering from malaria. So I'd love to run a rapid diagnostic test as well as a microscope to test that theory. And then I think it's a good idea as well to do a full blood count to see whether or not the patient has anemia as well.
Okay, all right. So the available investigation results, we have a malaria, a microscopy for malaria parasites, which reveals 2 pluses of malaria parasite. Did you get that?
Yes, 2 pluses. Thank you.
Of malaria parasite. And then we couldn't lay our hands on a full blood count. However, we have high hemoglobin, which is 3.3 grams per deciliter.
3.3 grams per deciliter of hemoglobin?
Of hemoglobin, yes.
Okay, so based off of this, it's clear that the patient has mild malaria as well as severe anemia. And going forward, I think that the patient should get a full blood transfusion because of her severe anemia. As well, to treat the malaria, she should undergo some ACT with coartem, which should help the malaria, and also some antipyretics to help mitigate.
Thank you. That's very impressive. All right. So what else would you advise the patient to do?
So in the future, to prevent malaria, it's a good idea to wear long sleeves and pants when outside to avoid getting bitten by mosquitoes, which is how malaria is spread. And as well, wearing insect repellent is a good idea, and using ITN is a really good idea while sleeping. And then in terms of the anemia, I think that the patient should think about her diet and try to consume foods that are more iron rich, such as meats and green vegetables. And that should help prevent that in the future.
All right. That's very impressive. That's very good, Kate.
Thank you.
You did very well.
Thank you.
Well in diagnosing, managing, and preventing malaria in the tropics. I would say it's quite impressive, and I'm glad you did so.
Thank you so much. I hope that the patient feels better and her sickness goes away.
All right, thank you very much. You have a wonderful day.
You too. It was really nice to meet you, Dr. Sadiq.
All right.